Even in many developed countries, children under poverty is an often neglected part of the society. In a highly diverse public forum, children are vulnerable. They are often politically voiceless because of their age, difficulties in families, and the surrounding environment. These are often obstacles that lead to unhealthy physical and mental development in child's early age, and this might cause further impact on their future life track. Messi Forbes, a director who works in a childcare organization called the 4CS, is here to share about some aspects of the charity child care workers in Johnson County. Forbes has been working in these organizations for years, and she helps provide pre-kindergarten educations to kids who have accessibility issues from numerous reasons.
We do childcare advocacy, and our mission is to level the playing field so that every child, regardless of socioeconomic status, has a clear path of early childhood educational experiences that lead them to a path to kindergarten readiness. And we do that in a lot of different ways. We run a child care center in Iowa City, mostly for low income children and families that are experiencing crises such as homelessness. We also work really closely with the child care workforce to make sure that they have the educational resources to um, be quality early childhood educators. The state requires that child care workers have a certain amount of educational hours each year, and so we have an educational program um, that we uh, administer to address those requirements. We also work really closely within the refugee and immigrant population, but also low income childcare providers who provide care to low income children. Work really closely with English language learners to make sure that they have resources to understand cultural differences of child care in the United States is different, and it can be different culturally than they may have experienced. And, there are DHS requirements surrounding that, things like that as well. And so we want to make sure that they have the knowledge and understanding of differences in that regard. Also, we just want to make sure that they're supported and have resources to have appropriate early learning environments for their children. We work with children who have adverse childhood experiences. It's called ACEs. One of the things that we want to that we recognize is that those adverse childhood experiences can also affect how a child learns. And so we focus a lot on training about mental health issues in those, or brain growth anyway, brain development, appropriate brain development, so that those early childhood educators can kind of recognize when a child might need some additional supports and things like that. We know that when a child does experience ACEs, that there is a higher propensity for them to just have a, different struggles as they grow up, as they learn. And so what we want is to make sure that we're addressing that with the care that's provided, and the educational resources that the providers have for when they're working with children that have those adverse childhood experiences. So, to become a childcare provider, whether you're working in your home or in a center, there's pre-service training that you are required to get within. I think when you're in a center, it's within the first few months of work, um, and that is a class called Essentials, and that's learning the essentials of childcare. There's also mandatory reporter training because as a childcare provider, you are required by the state to report any child abuse or neglect. And so that class goes over a lot of what to look for, what that looks like, things like that. And then there's CPR and first aid also that's required. And then additionally, once you've completed those trainings and you're a childcare provider annually you are required to do a certain number of hours to keep your registration or to keep your employment file, your employee file up to date. So those are the ongoing kind of trainings that are required by the state. We get state and local funding for the work that we do supporting the childcare workforce and for our childcare center. And the only federal dollars that we get are for our food program, and that again is to talk about nutrition. We get state funding for our childcare center to help support those and pay for those families that are experiencing homelessness. And then we get county and municipality funding to operate our indirect service that we do to childcare providers and that educational component of service that we provide. If you're referencing some of the stuff that I was talking about as like far as culturally, there are certain ways that we're supposed to, when you put a child to sleep, it's on their back and back to sleep, for instance, or you can't, baby wear is what it's called. So you will see a childcare provider can't do that sort of thing. So what might be very common in another culture just does not align with DHS regulations for a child care provider. So those are some of the things that we work with people on. Certainly if it's your own baby in your home, you are more than welcome to wear your baby, but just different things like that, just nuances like that for a registered provider or a licensed center, there are just certain things that you need to be in line with as far as those DHS regulations go. I don't believe that it's fair that if you don't have enough money to pay someone to watch your children, the level of your child's care should be less than someone who can't afford it. So when we talk about quality, that's what really that component comes into it. When we talk about accessibility, there are places that may have affordable childcare, but they are hard to get to if you don't have transportation, or the bus doesn't go over by there and things like that, or you don't have reliable transportation. And so it's about access too. So quality, accessible, and affordability. Those are the three things that we always kind of look at when we are thinking about how we can involve ourselves and things like that, or taking on a new program. Are we addressing quality? Are we addressing affordability? Are we addressing accessibility? And that's really, like I said earlier, our mission statement is to just level the playing field so that no matter what background, what financial background a child comes from, they're still able to get what they need, whether it's a quality childcare, early educational experience, or it's socialization, or anything like that. So the minute that they walk into kindergarten, that kindergarten teacher doesn't have to backfill what was missed, but those kids are all ready to learn, or they're all ready to be friends, or they're all ready to sit, or they're, anything like that means kindergarten ready, because it can mean so many things. I truly believe that in order for us to really implement quality programming in our early childhood educational system, it has to be subsidized by the government, just the way they do in K through 12 programs. Without having some other financial backing, the achievement gap is going to increase in that 0 to 5, 0 to 3 age range, as childcare becomes more expensive. And the only way to pass that cost on, if it's not subsidized by the government, is to passing that on to families, and that limits very much how many people can access it.